Hello, everyone. This is Elise Kiuna. I am doing my presentation over Sister Callista Roy. If I sound a little off, I do apologize. I am getting sick, so just bear with me, but let's get started. So first off, Sister Callista Roy, who is she? So as you can tell by the word sister, she is a nun. She is a nursing theorist, professor, and author. She was born October 14th, 1939. She is known for creating the adaptation model of nursing. So I would like to say that nursing is in her blood. Her mother was a nurse, and Callista Roy started quite early in her nursing career. At age 14, she began working at a large general hospital, first in the kitchen, then as a maid, and finally as a nurse's aide. Several years later, she decided to enter the Sisters of St. Joseph of Carondelet and became a nun. She is now 82 years old, and she is still actually very active in the nursing profession through policies and organizations and things like that. So she does have an extensive nursing education. She earned an undergrad degree in nursing from Mount St. Mary's College in 1963, followed by a master's degree in nursing from University of California, Los Angeles in 1966. Then she earned a master's degree and a doctoral degree in sociology from UCLA as well. She served as a postdoctoral fellow in neuroscience nursery, and she was awarded 4 honorary doctorates. So very, very busy lady. During her graduate studies, though, Roy was compelled by one of our other nursing theorists that we've come across in our course, Dorothy Johnson, to write a conceptual model of nursing, which is how she came about with her adaptation model of nursing. So Roy is actually very published and very acknowledged. She has over 100 publications, which include 11 books. She was a nursing professor at Boston College before retiring in 2017, so not that long ago. She was also designated as a 2007 Living Legend by the American Academy of Nursing. And like I said, she is still doing great things. So let's talk about what we're here for, the adaptation model of nursing. So this was developed by Roy in 1976. The adaptation model asks 3 basic questions of us nurses. Who is the focus of my nursing care? What is the target of my care? And when is nursing care indicated? So this model makes us kind of look at patients in a holistic perspective, which we should be doing anyway as nurses. Our patients are interrelated systems, and they maintain balances, or they need to maintain balances between various stimuli. And that's what this model promotes. We need to see the individual as that set of systems, and that we need to maintain that balance for them. So how are we going to do that? Well, per this model, there are 4 modes that we need to look at for every patient, and all of the modes are connected and interrelated, as I've said before. The first mode is the physiological physical mode. These are our body's basic needs. These are food, air, water, shelter, clothing. This mode also composes of the needs associated with oxygenation, nutrition, elimination, activity, rest, protection, feeling of safety. Like I said, these are our basic needs, which for our patients, we look at them and that's kind of our go-to. We want to make sure that their basic needs are met. The next mode is the self-concept mode. So this mode, the goal of coping is to have a sense of unity, meaning the purposefulness of the universe, sense of identity, integrity, or the need or the maintenance of the mind. So this is kind of the mind, body, spirit phenomenon in a sense. This includes body image, self-ideals, and things like that, making sure the patient feels, how they should within their body, per how they would like to feel in their body. The next mode is role function. In this mode, this focuses on the roles that a person occupies in society and knowing where they stand as a member of society. So this addresses people's adaptations to different roles and how they're changing throughout a person's lifetime. We go through our lives, we are daughters, we're sons, we're mothers, we're leaders, we're followers, we are, it's just ever changing depending on how our circumstance changes throughout our lifetime. And the last mode is interdependence mode. So this mode focuses on attaining relationship integrity through the giving, receiving of love, respect, and value. This is achieved with effective communication and relations with other people. So I take this as a nurse, we need to establish effective communication relationships and a good bond with our patients so that they know that we are there to help them. Once again, our roles as nurses. So according to this mode of nursing, or sorry, this model of nursing, the goal is to promote adaptation of the patient during illness and health in all four of these modes. The nurse's action begins with assessment because that's how we're going to figure out how we or what we need to do to help our patient. We need to make a judgment on the presence or absence of maladaptation, and then we focus on the stimuli influencing the patient's maladaptive behavior. Then we need to take action to promote adaptation by manipulating the environment, elements of the patient's system, or both as part of their nursing care plan. In the adaptation mode, nurses were facilitators of adaptation. That's kind of our job in this mode, or sorry, this model. We assess our patient's behavior for adaptation. We promote positive adaptation by enhancing the environment and everything inside of it. And we try to eliminate ineffective coping mechanisms, and which would hopefully lead to better outcomes for our patient. So let's break this down with 6 nursing kind of process steps. So my background has predominantly been in labor and delivery and OB and things like that. So I'm going to kind of give an example of how I would kind of run through the steps and how I would apply it to a patient situation. So kind of go back to your nursing school days and think about a 8 to 9 centimeter, no epidural, first time mother laboring, and just kind of picture that scenario. So I walk into the room. First step is assess the behaviors manifested from the 4 adaptive modes. So I look at my patient's behaviors. She's in pain. She's telling me she can't do this. She's uncomfortable. She's kind of losing it. So I need that. Those are her behaviors that I need to, as a nurse, fix. Second step, assess the stimuli. I look around the room. There are tons of visitors in there. They're not really paying attention to my patient. They're not providing her support. The room is hot. She has no water. She's hungry. She hasn't eaten since yesterday morning because it's a long labor. She is telling me that she can't do this. Her body can't do this. So I'm kind of going through the modes in my head and looking at different things that I can, change to fix my patient and help her. Step 3, make a statement or nursing diagnosis of the person's adaptive state. My patient's in pain and she's distressed due to XYZ. She's not coping well. Her environmental stimuli are not promoting effective coping mechanisms, and she's producing distressful behavior. So that leads to step 4, set a goal to promote adaptation. I, as a nurse, will provide certain interventions to hopefully correct my patient's stimuli and alter them so that it makes her have different coping processes that will hopefully make her have different behaviors, which will be more comfortable for her. Step 5 is to implement interventions aimed at managing the stimuli. So I'm going to go through all the modes and I'm going to try and help my patients best as possible. I'm going to provide water for her, give her a snack, change her position, try and make her feel better. I'm going to change the temperature room. I'm going to dim the lights. I'm going to ask the visitors to leave or please quiet down or please focus on her. I'm going to reconfirm to her that yes, she can do this. Her body was meant to do this, and that she's going to be a great mother. And hopefully through all of this, with the last mode, the interdependence mode, I will hopefully enhance the nursing patient bond so that she feels safe and that we feel connected. And then the last step, evaluate whether the adaptive goal has been met. Did this help my patient? Did her feeling of safety, was that promoted? Does she feel better? Does she feel less distressed and things like that? So just to go over it again, because it's a little confusing, Roy's adaptation mode, we as humans are holistic. We're interrelated systems. We have 4 modes per this model. Our mind, in a sense, mind, body, roles, and relationships. Within all of those modes, external stimuli impact those. We develop coping mechanisms, and those coping mechanisms produce a behavior. Our job as nurses, a nurse's role in the adaptation model is to manipulate stimuli by removing, decreasing, increasing, or altering stimuli so that the patient can get a more pleasurable outcome in their care. So, my question for all of you, and an exercise for you, is give a nursing care example from your experience. Apply Roy's steps and work through the modes. And what kind of care plan can you use to care for your patient's maladaptive behavior? I think that as nurses, we already run through this model already, but what this forces us to do is kind of look at our patient from a more well rounded, holistic view. Sometimes we get into a groove where we see patients as okay, they have this problem, they have problem A, let me provide intervention B, and there you go, C, they are done. Well, we need to look at them more rounded. We need to see, hey, what problems are going on mentally? What problems are going on with communications? Just as patients' role, do they feel safe leaving the hospital because of this role that they have at home for discharge? So this forces us to look at patients in a more rounded, holistic way, and I do really appreciate that because of this model. Here are my references, and of course, thank you. I hope everyone has a wonderful day. Once again, I do apologize for sounding so off, and I hope everyone have a wonderful day. Bye.